Nutrition is often ignored during the surgical workup, but it might be the most powerful modifiable factor in surgical outcomes. In this video, we uncover how surgical nutrition affects wound healing, infection risk, complications, and even mortality. Learn how to screen, supplement, and optimize your surgical patients. Poor nutrition increases surgical infections, delays wound healing, and doubles mortality. Malnutrition causes the following: impaired collagen synthesis, causing weak wounds; reduced immunity, which increases your risk of infection; muscle wasting, increases ventilator dependence on those in the ICU and decreased mobility; delayed gastric emptying, which is actually dangerous because it can cause an ileus or even risk aspiration; and overall increased mortality in trauma and sepsis. 30 to 50% of hospitalized surgical patients are malnourished and often undiagnosed. Malnutrition hides in plain sight. High-risk surgical groups include elderly patients, cancer patients, burn and trauma and sepsis patients, patients with IBD or short bowel syndrome, patients with chronic NPO status more than 5 to 7 days, or a decreased BMI less than 18.5, or those who are obese but sarcopenic. Lastly, albumin less than 3 grams per deciliter. It is a marker but not a cause. Don't wait for weight loss. You have to screen proactively. So how to screen for malnutrition? Look for the following: unintentional weight loss, decreased oral intake, GI symptoms more than 5 days, or chronic illness and cachexia. Once you flag risk, get a formal nutrition consult early. Nutritional optimization before surgery. Surgical outcomes start before the incision. If you have 1 to 2 weeks before surgery, use it to optimize. Strategies include oral nutrition supplements, high protein and high calorie; immunonutrition, which includes arginine, omega-3, glutamine, especially in GI and cancer surgery; protein targets, 1.2 to 2 grams per kilogram per day; control glycemic status and vitamin D levels. For cancer patients, follow the IRS protocol with pre-op nutrition built in. In summary, in the preoperative setting, nutrition screening is very important, together with carbohydrate loading, oral nutritional supplements, and reduced catabolism. For the perioperative, your NPO status only needs to be 6 hours for solids and 2 hours for liquids. Preserve insulin sensitivity. Postoperatively, early oral feeding, or ONS, enteral nutrition as needed, promote gut function and healing as well. So, enteral versus parenteral nutrition. Rule of thumb: if the gut works, use it. Enteral nutrition maintains the gut barrier, decreases bacterial translocation, decreases sepsis rates, and is cheaper and safer. Parenteral nutrition is reserved for non-functioning gut, those with an ileus or ischemia, those with increased risk of infection, thrombosis, and metabolic derangements, and is still life-saving when needed. When do we use it most commonly? Those with enteroatmospheric or enterocutaneous fistulas. ICU patients in feeding protocols. In critically ill surgical patients, nutrition is even more crucial. Start enteral feeds within 48 hours. Don't wait for bowel sounds or gas. Titrate slowly if unstable. Avoid overfeeding. Start hypocaloric, then ramp up. And consider trophic feeds early for gut protection. Daily check: are they eating? If not, why not? But you have to make sure that the patient is tolerating the feeds, and this may be dependent on: is the patient still recovering from a serious sepsis response, in which an ileus may actually adversely affect them. So, take it with a grain of salt, but be proactive in considering these recommendations. ICU patients lose up to 1 kilogram of lean mass per day without feeding. Key points. Malnutrition is common and occurs in 30 to 50% in surgical patients. Effects include increased SSIs, decreased healing, and increased mortality. Enteral is always going to be better than parenteral. Start early within 48 hours. Clinical peril. A well-fed patient bleeds less, heals faster, and survives longer. Don't let nutrition be an afterthought. And if you guys like the video, please click the like and subscribe button. And check out the other videos we have, and I'll see you guys next time.